I counted over 133 flu shots that I gave out. Hey everyone, my name is Kristen and welcome to my YouTube channel. I am currently in my last semester of nursing school, counting down the days till graduation. I have a little bit over 3 months left of school, and today I just kind of wanted to reflect back on my clinical experience and community and kind of talk about some tips and tricks that helped me through the actual lecture portion of the class. So if you're interested, just go ahead and keep watching. So I'm gonna first talk about my clinical experience and kind of how that went, and then I will leave a timestamp down below if you're only here for the tips and tricks, so you can go ahead and skip ahead to that part. I had a fantastic community health clinical experience. Now, I was at the local VA hospital in my area. I could have not asked for a better community rotation. I feel like this rotation was probably not your normal community health rotation. I did get to rotate around through some of the outpatient clinics. I don't know how I got very lucky with this clinical, but I actually did get to do tons of stuff that I'm so excited to talk to you guys about today. And I'm very grateful for where I was placed. I did get a lot of med-surg experience in this clinical, not something that a normal community clinical would have been. I feel like except for my project for class, I actually really didn't do a community assessment. Yes, I had pre and post conference. We talked about patients that we saw, but I don't really feel like in my community clinical, we really focused on the community aspect. It was really just outpatient clinics and helping out the nurses and the healthcare providers in those clinics. So I have a list that I wrote out of the different areas I rotated in. So I went to oncology, radiation, GI, flu shots, rehab, which is more of like a transitional unit. Like these patients aren't sick enough to be in the ICU, but they are a little bit more ill than just needing regular med-surg care. ED, wound care, and then there was a patient services clinic that I actually did not rotate in, but many of the students in my clinical group did. Now I am going to start at the beginning when I rotated in the wound clinic. Now I know I talked about this previously in one of my videos, I can't remember which one, but I talked about my experience in the wound clinic. Really, all I did was I was paired with a nurse. I followed the nurse around the clinic and I got to see 4 patients that day. And then I did get to see a couple extra, but those weren't my assigned patients. And really all the nurse and I did was remove the bandage that the patient had over a wound. We would cut it off, then we would assess the wound, kind of figure out what was going on, and then we would clean the wound, put some cream on, and then we would rewrap the wound. And most of these patients had some form of venous insufficiency, so we did have to put compression stockings on top. So I actually did get to learn how to correctly put on compression stockings, and there is a whole correct way to do it. But yeah, that clinical experience was definitely not my cup of tea. Be aware that wound clinics, there are gonna be smells. I know that's one thing I have to get used to. Like I'm fine with blood, I'm fine with urine, vomit. Something about smell is just that one thing in healthcare that I just can't do. Like I already know I'm never going to be able to work on a burn unit because I have heard that the smell can be a little bit overwhelming. And kudos to you if you can deal with that. I do happen to know my limits on how far I go, so I always make sure I keep lemon essential oil with me, that I put a dot right underneath my nose. I actually just bought one at the beginning of my program and I haven't run out yet. Now, other things that I saw in that wound clinic, a lot of the wounds were weeping. They were wet, they were soaked, they were bloody. Some of the wounds were as small as like a dime, and some of them were as big as like a baseball, a softball. So I can't even tell you, literally when you removed that bandage, I had no idea what I was gonna see behind the bandage because I didn't know these patients and I don't know their stories. Let me tell you, yeah, that was an interesting clinical. I remember the very last patient that day I walked into the room. I knew that the moment I walked in, something wasn't right because the room smelled so bad, and I'm sure the patient probably felt so self-conscious, and I didn't mention it, I didn't say anything, I didn't flinch. I'm really good at like keeping it together in those kinds of situations. And I got permission to kind of know what was going on, and I saw the patient's Achilles tendon. That was definitely a life-changing moment for me because I realized people go through things every single day that you don't even realize, and this patient probably just wears a bandage every day and you would never know the extent of what these patients go through every day. So I sat next to the patient, I talked to them, I asked them kind of what was going on, How did it get to that point? And just really listen to their story and kind of figure out what I can do to make them feel better. And on that note, after I finished in wound care, the wound care clinic closed early, so I did go over to flu shots and I did get to administer a couple flu shots. The next area I rotated in was oncology radiation. Now this is where I saw patients who were undergoing chemotherapy, some sort of radiation therapy. So I remember the first day that I was there, I mainly just observed. I did get to see the area where ports were put in. Like if somebody just got a port, I did get to see how it was healing. I got to see ports that were implanted in a patient for more than 8+ years. I did get to see how to do a blood draw out of a port. I actually did get to participate in that later on. A lot of it was just learning all about chemo, the different medications that they might use, the care that goes behind giving chemotherapy. For example, I know that there's a way that you're supposed to give chemo, and my nurse literally looked at me and told me, yeah, you're supposed to wear double gloves when you're giving chemotherapy, but I don't do it. I remember my nurse telling me, don't take that tip from me. There were some things that I was like, well, maybe you should be doing this in case something were to ever happen. You never know. So yeah, you'll get to learn all the policies and procedures that do go behind giving chemotherapy. Really, all that I did on that unit was take vitals, help give out snacks for patients who maybe were feeling lightheaded or maybe were just super hungry because they have to sit in the chemo chair for 4+ hours. I did a lot of paging the pharmacist and really just helping out my nurse when needed. And I really did take the time to get to know the patients that I was actually providing care for. I had a lot of free time on the oncology floor, so I really just did sit down and talk with the patients that were there. And halfway through the day, I actually got to go down into the basement where the radiation area was, and I did get to see a simulation take place. So essentially what I did while I was there wasn't really much for me to do because the radiation clinic was pretty much closed by the time I got down there. They were just finishing up a simulation, so I actually did get to talk to one of the healthcare professionals that was administering the simulation. They were just creating a mold for the patient to sit in whenever this patient went to go get radiation done. So you have to sit very still whenever you are being given radiation. So depending on where you are getting radiation, they have to program the machine to your body. Some people, like if they have to get it somewhere on their face, they actually do have to wear a mask. And I actually did get to see one of these molds being done, and I thought it was super cool. The oncology radiation, I feel like, is one of the places I learned the most from. Obviously, when you're giving chemo and you're giving all these types of meds that are intravenous, guess what? You do get to start IVs. And before you can give chemotherapy, you do have to draw blood to see their blood levels. So I did get to see and actually participate in all of that. The next clinical that I had was the GI clinic. Now this clinic is where I got to see endoscopies, colonoscopies, and really just all these other procedures that were going on that involved the GI tract. Many of these were procedures, so I actually did get to learn the pre-op and post-op procedures as well as the intra-op procedures, and I did get to participate in the pre-op procedures by doing intake, starting an IV, taking vitals on the patients, and then I did get to participate in intra-op. I actually did get to help take vitals frequently. I got to document. I actually did get to help with the specimen. I got to label the little canisters, and I know it might not seem like a lot intra-op, but let me tell you, there actually is a lot going on, and the nurse does have to be very alert when you're in the procedure room. And sometimes when they were down a nurse, they needed extra help. So the nursing student like me was there to help out. And it was so helpful for me to actually visualize and understand how to provide care in that kind of setting. So it was really nice because I had great providers in all the procedures who were wanting to teach me and really wanting me to learn kind of what was going on. I had med style questions being asked at me, which some of them I did have to guess on because I had no idea. I want to be a nurse, not a doctor. It definitely was a fun laugh whenever I did get something incorrect because I tried so hard to guess things correctly, but some of the information the providers asked me, I didn't have to know. It was out of the scope of my practice. You know, they helped keep the room and environment very light and funny just for the patient because the patient is in a twilight state and they are not completely asleep, but some of them are actually more awake than you think, and many of them do tend to ask questions in the middle. And you know, at first I didn't realize that some patients would be dead asleep and others will talk, and I had one that even stared at the computer screen while the procedure was going on and asked questions and wanted to know what was going on. And the provider was doing the best they can to maneuver the scope as well as answer the patient's questions. In post-op, patients would just take their time to relax. They had about anywhere between 30 minutes to a couple hours to really wake up and then get sent home. So most of these procedures were same day, they were in and out. I actually did get to see multiple procedures in one day, and in the post-op, I helped take vitals and really just get anything that the patient needed, like water or if they needed a snack or something. The next clinical day, I was in the flu shot van. Now for the flu shot van, I kid you not, I counted over 133 flu shots that I gave out. That is all that I did. They didn't want patients coming into the lobby to get flu shots this year, so they decided to do a drive-up flu shot van. Sometimes that line would be down and around the corner in the parking lot, so we had to work as fast as we could. I was actually the only nursing student out in the flu shot van that day. There were supposed to be a couple other students with me, but I was by myself with the other nurses there. I remember counting that I gave out 133, and I know I even gave out more than that because I did, like I said, give out flu shots at the beginning of the semester, and then throughout the year, we actually gave out flu shots to any of the clinics that we were in. The patients can ask any point in time, hey, I want my flu shot, no matter which clinic they're in, so I know I gave out a few more too. Really, all that we asked were the basic questions that normally you're asked when you get a flu shot: name and date of birth, or social security number, depending on what hospital you're at. Then I just asked, have you ever had an allergy to the flu shot before? Do you have an egg allergy? And then we asked if they had any symptoms of COVID. We really did make sure that they stayed in their car, and we asked them to stay 15 minutes after to make sure that they didn't have a reaction to the flu shot. And then they also filled out any necessary paperwork we had to have on hand before we administered the flu shot. Then I went to go wash my hands. I gathered my supplies, put on my gloves, put the syringe and needle together, make sure I push out all the excess air in the syringe, and then I would get my alcohol and I would go ahead and poke the patient. That was pretty much my day in flu shot, and like I said, one after another, and that's how the whole entire day went. The next rotation, I was in the rehab transitional care unit. Now, this unit, like I said, was very similar to a med-surg unit, but these patients were a little bit more ill. And really all I did was everything you would do in a med-surg clinical. I did hourly rounds, I did vitals, I got to do acu checks, gave meds, and I actually did get to participate. This was the first time in patient education. One of the patients did have to change their dietary habits, and so me and the nurse worked together to figure out some alternatives to help give the patient. We do as much as we can in education, and it's up to the patient to decide if they are going to go ahead and make those changes or not. Now, the last place I got to go to before I went back to oncology, radiation, and the GI clinic was the emergency department. Now, the day that I was in the ED was actually a very slow day. My nurse was working with a COVID patient, so I really just followed the other nurses around and the patient care technician, and this is where I got to start IVs. Now, the ED was the very first time I got to start an IV. I started 4 that day, and I have a story that I will never forget and will always burn in my memory because, you know, sometimes patients might not make it easy for you to be able to start an IV. I also did a couple blood draws that day too. I did get to learn about EKGs. I got to put a 12-lead EKG on a patient and actually produce the strip, and I did get to learn how to read it that day. Although I'm not an expert at reading EKGs yet, I am learning in med-surg right now, so it does help to have a little bit of a background going in. I remember there was one patient. I had 3 patients before who I successfully inserted an IV. I was super excited because, you know, that's a nerve-wracking experience. I had only had 1 day of experience of doing this. This patient was going through a lot, withdrawing, and I had told the patient, okay, I'm about to go ahead and poke you with a needle just to let you know this is gonna hurt a little bit. I don't know if the patient heard me, and you know, it's totally okay. All I know is that my nurse told me, hey, do you want to do this blood draw by yourself? I trust you. And I was like, okay, sure. That was a bad idea. I should have had a nurse, and thankfully a nurse ended up coming in right as I was about to start. And I was like, hey, do you mind just staying with me? Because for some reason I felt in my gut that something bad was gonna happen. And when I went to go poke the patient went like this, with the needle in the patient's arm, and it kind of poked in a couple places, and the needle didn't even go in a vein at all. And yeah, it was a mess. The nurse that happened to help me was not in the best of moods either, so that nurse was very agitated, and there was a very angry patient. I was like, I just want to get out of here, because the nurse ended up taking over, and by that point I had told my nurse what happened, and she was like, yeah, like it's just one of those days today. And I was like, that is true. So that's how the rest of my ED experience was. Thankfully, that was kind of at the end of my day, and I at that point was wrapping up and getting ready to go. Other than the crazy story of starting an IV with the patient that I had, which is ingrained in my brain and I will never forget that now, it's okay. I'm sure I will think of 100 more stories in the future of those same stories that I will always remember and take with me for the future. 2 rotations that I did get to repeat were oncology, radiation, and I did get to also go back to the GI clinic. Now in the GI clinic, I actually did get to start more IVs. So I want to say I've started 6 IVs so far, if I can remember the number correctly, which for a nursing student is crazy. There are some of the nursing students in my program who have never done a blood draw, never started an IV. And granted, I've never inserted a Foley catheter. I've never done trach care on a real human being before. So there are things on my skills checklist that I've never done, and they are doing the skills that I also want to do too. Thanks to being in the oncology unit as well, I actually did get to learn how to do a blood draw from a port, and I did get to start IVs in that area as well, under supervision, of course under supervision. That was pretty much my community health clinical experience. I was able to check off so many skills off my checklist. I loved this clinical. I really wish I could have gone back to this hospital for my med surg. I was actually supposed to, but we know with the virus and everything, I completely understand why I'm not allowed back in there. I am forever grateful for my community clinical experience, because this is where I learned most of my nursing skills. All right, now when it comes to the lecture class, I know I talked about it in previous videos. Community was not a cakewalk for me. It was one of those classes that there was no set book for the class. My professor did not have a textbook, and many students complained about it. We didn't have any knowledge on kind of where to guide our studying. We had PowerPoints that were 80 to 100 slides each. They were very messy, very disorganized. Some of them had polka dots in the background. Yeah, and my professor also provided us with online modules, like maybe 10 to 12 websites. But these websites were so vague and so broad that I never really understood what she wanted me to gain out of going on these websites. So I would click a website and it would take me to the homepage, and I'm like, okay, well, I know what the website is and I know what the website does for the community, but what do you want me to research on here? So it was very vague. It kind of was a struggle for me to really figure out where to go in this class, what to study. So really what I did that I really feel like helped me at least do well on the first and second exam, and I still did really well on the third. It was just one of my lower test scores. So I went through each of the PowerPoints and I would make a 1-page study guide for each of the PowerPoints I was going through, because my professor would have so many photos that weren't really relevant that I knew I wasn't going to be tested on. And my professor loved to test us on trends, community health, and what the trends looked like for that community. She loved trends. Although my professor said there was never going to be any numbers of trends on the exam, that was not true. There were always numbers that we had to know. We had to know statistics. So what I would do for study guides, I kind of gave up on the idea of making a full study guide for this class because I knew it wasn't very helpful to me. I really stopped going to the websites because I was very confused on even where to go. There was no direction. Really what I did is I utilized the PowerPoints that my professor gave me, and I would create a 1-page study guide out of that. Could have been 1 to like 3 pages. I never made any more for a specific slide set. So like, let's say on the exam, I had to learn about Medicare, Medicaid, Social Security. And I know that same exam, I was tested on like domestic violence, school health. So what I would do is for each PowerPoint I was studying, I would make a 1 to 3 page study guide. I'm just gonna quickly talk about how I went through the PowerPoint and how I made kind of a very shortened study guide. So a good example is just Medicare. I would go through the Medicare PowerPoint, I would ask myself, okay, what is Medicare? I would write that down. I would write down any statistic numbers that I saw on Medicare. I would write about who's eligible, and then I would write about how can I educate my patients to be able to get Medicare in the future. Now, another thing I would do is ask myself, Why do I need to know this as a nurse? I feel like that question saved me through so many of my PowerPoints. I would ask myself on every slide, okay, why do I need to know this as a nurse? I feel like for community, it was so broad, and I just had to keep reminding myself my scope of practice is only nursing. So I would constantly ask myself that question, why do I need to know this as a nurse? And you know, after each PowerPoint, I would have about 1 to 3 pages for each of the topics that I was tested on for the exam. So my study guides were honestly less than 15 pages, and really most of my focus for the exam came out of just looking over the PowerPoints over and over and over again until I started recognizing the trends and the numbers that I had to know for the exam. And I was even recognizing pictures and graphics. Y'all, sorry, my camera died. So like I was saying, I just got to the point where I started honestly memorizing this material. It made it a lot easier for me to apply it to the test questions. Most of the test questions on my exam were scenario based. They were these case studies. So just really having that small outline that I made really helped guide my studying. And really that is pretty much all that I did for community. I wasn't able to find any practice questions for community. ATI wasn't very helpful. My professor told me I would never benefit from doing any community health practice questions, although practice questions is the way that I learn the best. You know, community, the lecture was actually a little disappointing, and I actually did not save any of my study guides. I was told none of that information was going to be on the NCLEX, so I got rid of all my community study guides because I didn't think they would be useful for the future. I am not sad about getting rid of that material because now I don't even have to look at it anymore. My biggest suggestion and biggest takeaway when it comes to community, keep asking yourself why you need to know this as a nurse. And I really tried to critically think as to how a test question might be asked, or what I might be asked, or how this might show up on the exam, and the scope of the nursing practice. That pretty much wraps up this video. I really hope that you liked this video. If you did, please don't forget to give the video a thumbs up, and of course subscribe to the channel, join my Facebook group. Feel free to reach out to me at any time, leave any comments, questions, or anything you have down in the comment section down below. And of course, I just want to wish you good luck on your nursing journey.